Hello and welcome. I wanted to give my subscribers an update on a situation I've been dealing with regarding my left eye, as you can see covered by a patch here. And for those of you who may be joining the channel because of this video and are interested about retinal type surgeries, welcome to the channel. I have a regular channel wherein I feature smart home devices and review those, and also show how to get things set up to establish your smart home. So if that interests you, you can certainly subscribe to my channel. But mainly I wanted to give my viewers sort of an update on what's been going on in my situation. So let me go back to January of this year. Now, you have vitreous fluid in your eye, and as you age, usually from anywhere from age 50 and on up, the vitreous fluid, which is normally a gel-like substance, starts to get more watery and it pulls away from the back of the retina. And usually that happens without you even being aware that it's going on. In my case, I have sort of a sticky membrane, I guess, on the vitreous sac that caused a small rupture. And so the pulling away was rather abrupt, and I saw a flash, and then I saw a lot of debris in this left eye. And so I went to see an eye surgeon who referred me then to a retina specialist. He said the eye was really cloudy, and he did identify that I had what he thought was a rupture, but not a tear. That's different than a tear. So the rupture creates some bleeding in the eye, and I saw a lot of specks, real fine specks that was in the eye. Those cleared up eventually, but then I still had large floaters. And I've always had floaters, and some of you may have those as well. This was different. This was almost like large blurry globs. They were translucent globs, but yet they were very distracting because they kept moving back and forth in front of my vision, particularly when I drove and you have to shift your eyes quite a bit to watch the mirrors. I had constant disruption in this eye. So the retina surgeon, the retina specialist, I should say, recommended I have surgery to basically remove the vitreous fluid and replace it with saline. It's a fairly simple procedure. There is a chance of complications, but in most cases it can be done pretty safely, but you need to consider the risk. And so he wanted to make sure that the situation was difficult for me before I elected to go with that level of surgery. Well, it's fortunate that I did that, because there was an underlying condition, which I'll mention in a minute, that I was unaware of. The procedure, by the way, is called a vitrectomy, and again, they put in a probe, well, 3 probes in your eye. One is to basically shine light on the retina. The second probe goes in and it acts like a little vacuum to break up and suck out the vitreous gel-like fluid in your eye. And the third probe can inject a gas bubble if necessary, can also inject the saline that backfills your eye. If your eye did not have some sort of fluid to equalize the outside pressure, it would actually collapse. So that's why when they take something out, they need to substitute either an air bubble or fluid in order to reinforce the eye. During the surgery, what the retinal specialist found was, after taking out the vitreous fluid, that I had a total of 9 retinal tears. Now, this is not the retina pulling away from the back of the eye. It's basically just several small tears. Some were small, some were a little larger. What they do in that case, when they find that, is they need to insert that gas bubble. The gas bubble kind of fills the eye cavity and holds the retina in place. And once they have that gas bubble injected in the eye, then they use a laser to basically tack weld around these retinal tears. So that's what he proceeded to do. And that, I'll tell you, you're awake during this surgery. However, they give you a level of sedation and also numb the eye so that you really can't feel a lot of discomfort. I felt a little discomfort, but not significant. And so you can see, I mean, obviously you can't see the probes or the lasers or anything like that, but you can see a light show. It was quite interesting that the flashes from the welding, if you will, the tack welding, all around those tears. I can't remember the number, but it was a fantastic number. I think he said thousands of tack welds to basically fix those retinal tears. So the lasering, basically, as I said, tack welds the retina in place against the back of your eye, and then the bubble helps hold that in place. So following surgery, what I needed to do, didn't expect to happen, was I needed to be in the face down position 55 minutes of every waking hour. So I only got it was 50 minutes, 50 minutes of every waking hour. So I only got a 10-minute time frame to be able to look up and move around. And I'll tell you, what you do not realize is that when you're in that position that long, you get great tension in your shoulders and your neck. And I had to, once I was allowed to get in the shower, which was after the first day, I got in there a couple times a day just to let the hot water run on my neck and shoulders to kind of relieve the stress that I had from being in that constant head down position. So you're face down 50 minutes of every day for the first, in my case it was the first 5 days, in some cases it could be longer. The thing that surprised me the most, that I didn't fully appreciate, they did tell me that my vision would be blurry. And by the way, they have you, when you come out of surgery, you have a hard shell eye patch on that's taped over your face. And that stays on the first 24 hours, and they have a follow-up appointment the next day where they take that off and they basically measure the pressure in your eye and make sure that everything's healing okay. So I didn't know what to expect until that was taken off. And when it was taken off, blurry does not begin to describe what I was seeing through this eye. And this is 9 days after surgery. I don't know if you can see here, but I still have some bruising. I had a real big shiner after surgery. And I also, the whites of my eye was totally blood red, all parts around my eye, which is part of the bruising. It's pretty cleared up now at my 9th day post-surgery. But the thing I said, as I was saying, I did not expect was the level of, or I should say the lack of vision that I had in this eye. Essentially, I would think that I'd be classified as legally blind in this eye. And by the way, that's going to stay there as long as the bubble's in the eye. The bubble is reabsorbed by the body slowly, and so it shrinks, and as it shrinks, I'm told that my vision will improve. And actually, the bubble, because it's lighter than the fluid, I guess, is at the top of your eye, but since you see things in an inverse, it looks like I can see the top of the bubble. I guess what I'm seeing is actually the bottom of the bubbles, because the image on your retina is upside down, if that makes any sense. So to describe what I'm seeing, if I close my right eye and look out my left eye, I can barely see my fingers on my hand. It's kind of like looking through a fish bowl that has maybe frosted glass. Things look magnified. I can see the color of my hand. I can see the green bracelet, which I'll talk about in a minute. But beyond that, if I take my hands down, I cannot see anything other than color and light. So it's large blotches of color. I'll try to emulate what I see on the screen. I also see a line, which I think is the bottom of the bubble that looks like it's on top. And then I see some up here, but it's all blurry. This below the line is like water. So if I shake my head, I can actually see it, the water kind of wave around. And it's even more bizarre if I look down and shake my head, because it's like you're looking at the top of the fish tank and you're shaking the fish tank and the water's jiggling. It's the best I can describe it. It's a bizarre feeling. So the reason for the patch is mainly because it makes vision very difficult if I open both eyes with all the distraction that is occurring in this particular eye. So it makes it much easier to see if I cover this eye. I'm still under restrictions not to lift anything heavier than 5 pounds, and it'll be that way for several weeks. And like I said, this is kind of a 6 to 8 week process, and I'll slowly regain vision. As I understand, as that bubble shrinks and is displaced by the natural fluid that my body supplies in the eye cavity, I'll be able to see more and more, and eventually that bubble should go away to practically nothing. So the amount of time that it takes to regain vision depends from person to person. It also depends on what type of bubble they put in your eyes. Mine was a short acting bubble, I guess, or a dissolving bubble. And some people get the type of gas that lasts in your eye a lot longer and could extend for months. But he told me possibly 6 to 8 weeks I would regain most of my vision, I think. So I mentioned the bracelet here. The bracelet has information on here that basically warns a doctor if I would have to go in for a procedure that there's a gas bubble in my eye. And the reason for it is that you cannot go under certain sedation because it could cause permanent blindness. You also cannot, you need to avoid an airplane ride or going up into the mountains, anything high altitude. It could create undue pressure in your eye and also cause blindness. So I need to keep this bracelet in place until the bubble is completely gone. At nighttime, I mentioned that during the day, every 50 minutes of each hour, I had to be in a face down position. At nighttime, I needed to, for the first 5 days, I needed to wear that hard shell patch that they gave me, and I needed to lay on my left side. He wanted me on my left side. And the positioning varies depending on where the retinal rupture or tear is. They want to make sure that they position that gas bubble so that it's pressing against those tears, which are in a constant state of healing, to make sure that they adhere correctly and there's no fluid that gets behind the retina. If fluid gets behind the retina, you'll begin to lose vision. So if you have a retinal tear that results in fluid getting in behind it, you need to get immediate surgery to take care of that, or you could risk losing your eyesight. As far as my channel is concerned, I was fortunate that I produced 3 additional videos ahead, and I've got them scheduled. I think they go through November, so I've been publishing every other week. I think I have one coming up here at the end of October, and I have 2 scheduled for November. So I'm fortunate that way that I'll have some videos in place that deal mainly with the Homey Pro Hub, and I think you'll find those interesting. So look forward to those. And hopefully towards the end of November, this thing will resolve some to the point where I'll be able to produce additional content. It was mostly difficult to endure those first 5 days where I had to do the face down positioning. That was difficult. It is difficult not being able to do some of the things. For instance, I'm not allowed to mow my yard, and it needs to be mowed. Fortunately, my son's coming from out of state to visit, and he's going to be able to help out with some of that stuff. I also need to do things like remove a window air conditioner, which I can't do because of the 5-pound weight limitation. But I'm fortunate to have family and friends to help out in that situation. So just wanted to give you a quick update of what's going on. Just wanted to let you know that there will be content coming up, and hopefully I'll be able to begin producing again later in November so that that can continue going forward. Thanks for watching today. Hopefully, if you have a vitrectomy coming up and you're kind of unsure what to expect, this would shed some light on what to expect. Hopefully, you can have the simpler procedure where they just remove the vitreous fluid and replace it with saline and you're good to go. But should they find retinal tears, they will be going in and repairing those, and they'll likely insert this gas bubble. And I just wanted to give you an awareness. You can expect that the eye that they do the surgery on to be significantly compromised and be that way for some time. But I'm assured that it'll get better over time, and I'm certainly looking forward to that. Thank you.